Nobasutu Hejana is monitoring the process there. Nobasutu, good morning once again. When we spoke about an hour ago, you had a very happy couple. The process was smooth for them, and they say that it was quick, it was easy. Is that still the case? Are things still running smoothly?
Well, certainly, Vega, according to the department or the Western Cape government, 6,646 elderly people were vaccinated at old age homes, and about 6,000 healthcare workers who are persons over the age of 60 were also vaccinated. And currently we're here at the Karl Bremer Hospital. There are long queues and a number of people actually who've not yet got those SMSs confirming that they can come for their vaccinations, but no one is being turned back here. But I'll also get the confirmation from Ms. Juanita Arendse. We've seen quite a number of people who are coming here to say they've not confirmed or they've not received those SMSs confirmed, and there's actually a line that is assisting those with SMSs. So can you just take us through as to how are you dealing with such cases?
Sure. So what we are doing is all our clients who do have appointments are being channeled through according to their appointment, and then those who are walk-ins, we are trying to channel them in between or later in the day. So unfortunately the waiting time for those without appointments will be a little bit longer than those with appointments, but I think the vibe here is of such a nature that everybody's just grateful that they will be seen, and we try to ensure that our resources align to what the need is. But I suppose also when we consider the fact that we want people to physically distance, that we also need to try and stick to appointments as best possible so we can ensure that our vaccination centres don't become super spreader events.
And there's also been concerns about the overlapping, because we understand some healthcare workers are yet to get their vaccines or are currently getting their vaccines while we're on the second phase assisting the elderly. So can you please also share with us those concerns?
Sure. So look, through the eNCA program, first of all, we have managed to vaccinate 70% of our healthcare workers, of the 132,000. So our balance is about 30-odd thousand healthcare workers, and that's if we make the assumption that all healthcare workers would want the vaccine, which we know would not be the case, like with anybody. It is a choice. And so we're assuming that our balance is around 15,000 healthcare workers, and that on top of our target of 750,000 persons over the age of 60 is what we're having to deal with. At this point, we don't feel that there's going to be any constraints in dealing with the healthcare workers, because we just had a few healthcare workers come through now, and we channel them through because they also need to get back to their clinical environments. So we are making sure that our healthcare workers come through the system, that we see to them while we are attending to the person 60 years and older.
And I'm looking at the queue. There's quite a lot of people here, obviously compared to last year where there were fewer numbers. So are you confident that by the end of the day here, you'll be able to vaccinate all these people in this queue?
Yes. So our vaccine supply is adequate. We do have enough staff on site as well. Our intention is to try and get through all the queues that are here by the end of today. But I think the teams here are so willing to go the extra mile. So whatever's required to get through the queues, they will do the necessary to do that. Yeah.
And what have you heard? Because I was speaking to one elderly person here, was talking about their concerns with regards to the vaccine. So have you had any of the issues where people come here and they start informing other people on the queue that, I mean, I'm not going to say what the other gentleman said, but have you heard those conspiracy conversations around the queue?
Yeah, I suppose everybody taps into social media and everybody hears the conspiracy theories, and I suppose, when those conversations come up, we have got our queue marshals, we've got our nurses that walk in and out, so we try and mitigate where possible, but it's not something we'll ever have control over. We're so dependent on the rest of society and government to assist us in helping with those conspiracy theories and helping us to get the message across about why it's important to be vaccinated. We don't want further waves of this pandemic, and this is our best shot at the moment, obviously in conjunction with physically distancing, wearing our masks, etc.
And the fact that the private sector is also assisting when it comes to the vaccination side, that will also ease the pressure on the public sector.
Yes, it definitely will. It definitely will, and we're pleased that our private sector colleagues are coming online. They've come online. Some of the sites came online last week, Wednesday. I saw some photographs over the weekends as well at some of the sites. So yes, it is coming on board steadily, but we're looking forward to reaching our targets because we intend on getting through our target audience of 60 and older by the end of June. Again, making the assumption that at least 80% of them will agree to have the vaccine, which puts us on about 600,000. And so the plan is to get through them, and with the help of the private sector colleagues, we are confident that we're going to get there. Yeah.
Right. Thank you very much. Juanita Arons, who's also part of the provincial vaccination lead here in the Western Cape. Yuveka?
Jana, thanks very much. That's a look at some of the provinces and how phase 2, week 2 of phase 2 is actually being rolled out. Seems a little bit better, but still some problems being experienced in certain parts. Still on the way.